Welcome back to my channel. Today I'm going to discuss about OET reading part A. I believe OET reading part A is quite challenging. You have to complete 20 questions within 15 minutes period. If you don't know the techniques and tips how to approach the OET reading part A, it is very difficult to find out the answers. Today I'm going to teach you all the techniques and tips and how to approach OET reading part A. Today's topic is psoriasis and let's begin today's topic. Okay, when you get the question booklet, what you have to do? You have to underline, you have to read the title. Okay, first you have to read the title. What is the title? It is saying psoriasis. Then you have to underline, you have to read the passage test A. Test A is talking about psoriasis. Okay, you have to underline some keywords, diagnosis. Okay, there are some points they are saying diagnosis. Here is their psoriasis, plague psoriasis. Okay, and here is lupus erythematosus, some signs, symptoms. These are the points they are discussing in first paragraph, first test. Okay, so you will get four texts, that is test A, test B, test C, and test D. And you have to complete 20 questions within 15 minutes. In this topic, test A is talking about psoriasis and diagnosis and symptoms and some like, and these are the same sign symptoms. Some good type psoriasis. Sometimes also they are same pustular psoriasis. So you have to understand. You have to keep it in your mind what it is saying. If you are getting some difficulties, you can write somewhere in a small note. Okay, test A, diagnosis, symptoms. Okay, you have to write somewhere in the question booklet. Okay, so question booklet or in the test booklet. Okay, and before giving the answer key to the examiner, you have to erase the knots. Okay, so you can do like that. Okay, you can apply this technique when you are doing the practice. You can apply this technique and you can apply during this technique during the exam also. Okay, if you are not getting what it is saying, if you are not you are getting any difficult to understand what test A is saying, so you write somewhere in the question booklet. Okay, somewhere in the question booklet or answer booklet, somewhere in the side. Okay, somewhere in the answer booklet, write somewhere. Okay, where test A, diagnosis and signs and symptoms of psoriasis. Okay, like that you have to write. Then test B, see, test, you have to underline. I already told you have to underline the keywords. Okay, you have to underline the keywords. Some keywords also you will get, just underline. That is diagnosis, just underline, just make an underline. Okay, then come to the test B, that is adult psoriasis topical treatment pathway. Some it is talking about adult psoriasis topical treatment pathway. They are saying 4 steps. You have to underline this also. This also, see here, it is if it is tongue or limbs, if it is face, flesh or gender, what are the treatment we have to use. So these are the points they are saying. So you have to underline these are the points. Okay, are you getting my points? Okay, test A is saying about the psoriasis diagnosis and symptoms. Okay, test B is saying about adult psoriasis topical treatment. Here the treatment is corticosteroids. Okay, see, vitamin D. Okay, potent corticosteroids, potent corticosteroids, vitamin D complex. These are the points they are discussing. So you have to keep it in your mind. Otherwise, you have to write somewhere this part B, psoriatic treatment pathway, treatment pathway, corticosteroids. Some medications are also discussing in part B. So only that much. Don't write too much. Okay, only 1-2 sentence. Okay, 1-2 words. Okay, just for understanding. Third, part C. Part C, sorry, test C is saying psoriatic arthritis. The abbreviation is they are given PSA. After that, they are saying CASBR classification criteria for psoriatic arthritis. Okay, there are some criteria also they are saying what are the criteria, category and description points. Points are also they are given. Okay, so you have to remember CASPR category and PSA. These are the main points discussing in test C. So you have to mention somewhere in the question booklet or text answer booklet. Okay. The test is D is again talking about children and young people psoriatic topical treatment pathway. Okay, D is also talking about the psoriatic topical treatment pathway. I hope you are understanding what I am telling you. Okay, test what is test A saying? Test A is psoriatic. So psoriasis diagnosis types and diagnosis type and signs and symptoms is talking about psoriasis part test A. Test C adult psoriatic topical treatment. Here they are saying about the corticosteroid. Okay, corticosteroid medications and medications. Okay, test C is the psoriatic arthritis, that is PSA, and the CAS PAR. Some criteria is also they are given. Okay, just these are the point. Don't go deeply. Okay, just understand what it is saying. Okay, if you do this way, you can easily find out which passage contain which information. So you can easily find out the question's answer. Okay, so test D is saying about the children and young people psoriatic treatment pathway. So two test is saying about the treatment. Test B and test D. Okay, you got you are you getting my point? Okay, test B and test D is talking about treatment. So unless you come to the question booklet, okay, this is the question booklet. So you can write somewhere here test A. Here you can write somewhere test A is saying about the psoriasis diagnosis. Test B is a treatment pathway, adult treatment pathway. Test C category, CSR category, and the PSA. Test D children and young people treatment pathway, like that you can write somewhere in the test booklet. Okay, after the test you have to erase it. Okay, you keep it this point. Okay, then you have to start from the you will get 20 questions. 1 to 6 is mark the following, and 7 to 14 is short answer, and 15 to 20 is sentence completion. Okay, either you can start uh, from the beginning, or you can start from the short answer type of question, that is from 7 to 20. Both way you can use. Okay, both way you can apply in OET reading. Sorry, both way you can apply in OET reading subtest. Okay, uh, either you can start from beginning, or you can start from question number 7. Okay, but I have noticed so many students are I have noticed it is very easy to start from question number 7, because if you start from question 7 to 20, you will get some awareness about the passage. Okay, you will get some awareness about the passage. You have to find out these questions answers in the passage. Okay, you will get an idea about the passage, so you can easily get the answer in match the following. Okay, you can easily find out the answers in match the following. Okay, you have to follow this technique. First question. Okay, we are going to do the first question, that is question number 7. Okay, in addition to the arms and legs. Okay, always I am telling you, you have to underline the keyword. You have pencil, you have to underline the keywords. Okay, you are going to find out this keyword in the passage, and you will get the answers wherever you got the keywords there. Okay, if you didn't get the keyword there, you won't get answer there. Okay, so you have to underline what the question is asking. You have to underline the main keywords. Okay, what is the main keyword? In addition to the arms and legs, in addition to the arms and legs. Okay, arms and legs is one keyword. Which area of the body is most likely to be affected? Okay, you are getting my point. Most likely to be affected by chronic plaque psoriasis. Okay, what are the keywords here? Arms and legs. Which area of the body most likely to be affected by chronic plaque psoriasis? This chronic plaque, this keyword is not going to change. There won't this chronic plaque psoriasis, it won't change. It's a common word. Okay, chronic plaque psoriasis. You have to find out this keyword in the passage, where you will get the where you will get this information. Chronic plaque psoriasis, arms and legs, most likely you will get this information in the passage here. So you have to go to the passage. Okay, we already know what it is saying. Passage is saying A what it is saying, B is B what it is, C what it is, and C we already know some information. Okay, so you have to go there first. Which passage you got out, you go there, you have to do skimming. Skimming means fast reading. Okay, skimming means fast reading. You know the keyword. Okay, you know the keyword, and you have to go to the passage and do skimming, okay, and you will get the keyword somewhere in the passage. You will get the keyword somewhere in the passage. You have to keep your hand there and you have to scan it properly, okay. You are getting my point. You to keep your hand there, you have to scan it properly. You will get your keyword there and you have to scan. If you are not getting the keyword there, you won't get the answer there. If you are not getting the keyword, you won't get the answer there. So you have to go to the passage one, skim fastly, skim fastly. You have to find out the keyword. If you are getting the keyword there in the passage, somewhere you will get the answers, okay. Somewhere in the surrounding area you will get the answer. Are you getting my points? Okay, now we are going to test A. Okay, test A. What is the question? In addition to the arms and legs, okay, which area of the body is most likely to be affected? In addition to the arms and legs, which area is most likely affected by chronic plaque psoriasis? Okay, are we getting? So um, every students, who all are there, who all are going to appear the exam, you have to get 20 out of 20. That is my motto, okay. That's why I am uploading OET reading materials every week. So you have to watch my videos till the end. You will get so many tips and tricks. Definitely you will get 20 out of 20 in OET reading part. That is my guarantee, okay. Please believe me, you will get definitely 20 out of 20. You will get, okay. I will teach you what are the techniques, tips, everything I will let you know, okay. So come to the passage one. What is the points? What are the keyword? Arms and legs most likely affected and chronic plaque psoriasis, okay. Arms and legs, okay. So we have to find arms and legs, chronic plaque. So you have to fastly you have to skim. So first listen, then you will get the keyword. Then you have to keep your hand there and you have to read surrounding the areas, okay. So diagnosis, chronic plaque psoriasis. Here we chronic plaque psoriasis, okay. The most, see, from here we are getting some point. The most frequent presentation is chronic plaque psoriasis. We got the keyword here, chronic plaque psoriasis, okay. We have to read from here, okay. That is psoriasis vulgaris and is characterized by well demarcated bright red plaque covered by adherent, uh, sorry, I will erase them. See, chronic plaque psoriasis, yeah, is characterized by well demarcated bright red plaque covered with adherent silvery white scales. These may affect any body site, often symmetrically, especially the scalp and extended surface of the limbs. So they are given extended surface of the limbs, okay. Often symmetrically, especially the scalp and extended surface of the limbs. Okay, what is the question? In addition to the arms and legs, what are the points they are given? Extended surface of the limbs. Limbs, what are the limbs? Arms and legs, upper limbs and lower limbs. So we got the keyword there, okay. Then in addition what? In addition, especially the scalp, only 2 points they are given. In addition to the arms and legs, it will affect the scalp, okay. Are you getting my point? Then what is the answer? In addition to the arms and legs, which area of the body is most likely to be affected? The chronic plaque psoriasis. So what is the answer? Scalp. Okay. See, we got the keyword chronic plaques there, arms and legs, and most likely affected. Okay, we got three keywords here, and we got the answer in the exact point. This is the way you have to find out the answers. Okay. Second one, in what age range does PSA, typically PSA is 1 point, okay, another keyword, develop in patient with the psoriasis, okay. In what age range? Some age ranges they are asking, age range. You have to find out any age range is given in any passage, okay. But they are given another keyword PSA. You have to find out this word PSA, where it is, okay. So see, only one passage we got information about a PSA. Which passage? See, PSA. We got the keyword here. And then what is the next point? In what age range does PSA typically develop in patients with the psoriasis. Okay, in what age range? Okay, see, you have to read the points. You have to scan from here, and you will get some information. You have to keep your hand there, and you will scan it properly. Psoriatic arthritis is an inflammatory disease associated with psoriasis. It is unclear. It is unclear actually how many patients with psoriasis will develop PSA, but it is could be high as 48%. PSA may develop at any age, but usually presents between they are between 30 to 50 years of age. Okay, see, what is the question? What age range? What is the age range they are saying about the PSA? 30 to 50 years. So you have to write 30 to 50 years. Age range is 30 to 50 years. Okay, you are getting my point? Are you getting my point? Next question. When treating psoriasis, okay, when treating psoriasis, treatment is treatment. So treatments are given in two passes, pass number B and D, with very potent corticosteroids. This is also another keyword, very important keyword is how long should be left. How long should be left between course? Okay, how long should be left between course? These are the keywords. So what are the keywords? You have to underline the keywords. Okay, when you get the question booklet, you have to underline the keywords. Okay, you have to underline the keywords. Okay, are you getting my point? You have to properly underline the keywords. Okay, when treating psoriasis, very potent corticosteroids, how long should be left between? So we got information about treatment in two passages, passage number B and D. So first you have to go to passage number B. Okay, and what is the question? uh, uh, when treating very is also important, very potent. Okay, when treating very potent corticosteroids, we have to fastly skim. Very potent, see here it is saying potent, not very potent. Okay, very potent, where it is very, here also potent, it's a potent, but we didn't see any very potent. Okay, uh, yes, here it is very potent corticosteroids we got here. Okay, when treating uh, when treating psoriasis with very potent course, how long should be left between course? Okay, what it is saying? Aim for a break. So here we are getting left between means that is break. Break is another word of left. Okay, aim for a break of 4 weeks between course or treatment with potent or very potent corticosteroid. So what is the answer then? What is the answer? 4 weeks. Okay. When treating psoriasis, very potent course, how long should be left? How long should be left? 4 weeks. To write 4 weeks here. Okay. Not every keyword is, please, not every keyword. Okay. Are you getting? Then come to the next question. Okay. Then come to the next question. Okay. What is the next question? Question number 10. Okay. What may be prescribed? So here is, so they are saying some medication. What may be prescribed as an alternative to coal tar preparation? So this is also talking about a medication. So we have to find out either in part B or D. Okay. What may be prescribed as an alternative, another keyword, to coal tar preparation? This is also another keyword. So go to option number B. Fastly skim coal tar anywhere. Coal tar. Alternative to quarter. Here is a quarter, but it is not saying any alternative. Okay, because you have to say, um, see, Detranol could be considered as an alternative. See, we got the keyword to quarter, another keyword. Okay, see, what are the keyword we got? Alternative to coal tar preparation, and what may be prescribed? What may be prescribed? Ditranol. So what is the answer? Ditranol. Ditranol. Ditranol could be considered as an alternative to coal tar preparation. So ditranol. What is the answer here? Ditranol. Okay. Ditranol. How much non-steroid cream? So here is also they are talking about some non-steroid cream, that is treatment, should be prescribed for application to a child's tongue. Okay, how much non-steroid cream should be prescribed to application to a child? So we have to go to part B or test B. Sorry, test B or test D. Okay, so here it is a non-steroid cream, and this is the one keyword. So child's tongue is given. Okay, child's tongue is given. Okay, how much notes? How much tongue? Go to part B. If it is any non-steroid child's tongue, okay? Non-steroid child's tongue limbs. There is a tongue can given child's tongue. It's a topic treatment for adults, so it's not. It is not talking about the child. So then you have to come to the child. This children, okay? Area of the body and face and neck, trunk. See, trunk is given. Okay, trunk. Child's trunk. Creams, non-steroid cream. Non-steroid, non-steroid. See, what is the keyword? What are the keyword? What are the keyword? Non-steroid cream should be prescribed for application to a child's trunk. Okay. See, we got the keyword non-steroid. Trunk we got. Children also we got. Child's trunk. How much? How much we have to apply? 400 gram. What is the answer? 400 gram. What is the answer? 400 gram. Are you getting my points? We got the keyword non-steroid. We got children we got, trunk we got, 400. These are the keywords we got here. So, what is the answer? See, tell me what is the answer? How much notes we have to apply? 400 gram. Okay, please follow my technique, please. Okay. What is the maximum amount of calcipetrol? This is also medication. We have to find out maximum calcipetrol to be prescribed for a 13-year-old per week. 13-year-old per week we have to how much 13 some that is 30 and 13 year means children, okay, that is children, okay. Medication calciprol maximum, so we got medication from, we got the information. We will get the information but test B or test B D. Again, usually test B is saying about the adult preparation and test D is talking about the children and young people, okay. So go to the last part of the calcipetrol we got. Children age they are given the weight they are given 13-year-old per week. So here it is 6 to 12 years maximum 50 gram, okay. Okay, maximum 50 gram. Over 12 years of maximum 75 gram. Over 12 years is the question is saying 13 years. That means over 12 years. Okay. Then we got the keyword 13 years there and calcipetrol we got. Then maximum amount. Maximum. What is the maximum? Another keyword here. Okay. What is the maximum amount? 75 gram. Are you getting my point? Are you getting how we are approaching the answer? Are you getting? Can you follow my point? Please message me. Please message me if you are getting the way we are finding the answers. Please message me. Can you follow this method? Please message me. Okay. Calcipetrol we got and age over say that is over 12 years, that is 13 years and above. Okay. And maximum we got here and amount. Okay. What is that? 75 gram. Okay. Next. What should be prescribed? Again, they are talking about medical prescribed for a patient with a facial psoriasis. Facial psoriasis, which doesn't respond to moderate corticosteroid. Here, corticosteroid they are saying moderate, one keyword, moderate corticosteroids, facial psoriasis, and prescribed that is medication, either B or D. So, first we have to go to the first we have to go to the B, and if it is not there, then come to the D. Okay, then moderate facial. See, we got face here. Okay, facial psoriasis, adult psoriasis, facial psoriasis, and moderate corticosteroids. We got here moderate corticosteroids. We got, and what is the question? What should be prescribed for a patient with facial psoriasis which doesn't respond to moderate? What should be prescribed? What should be prescribed for a patient with the facial psoriasis which doesn't respond to moderate corticosteroids? That is the question. See, discontinue if unsatisfactory response or continuous treatment required to maintain. If it is discontinue, we have to start calcineurin inhibitor. So, what is the answer? If it is unsatisfactory response, we have to continue. We have to continue with the calcineurin inhibitor. So, what is the answer here? What should be prescribed for a patient with facial psoriasis which doesn't respond moderate corticosteroid? Then what is the answer? Calcineurin inhibitor. Okay. This is the way you have to find out the answer in OET reading part A. So OET reading part A is very very important. Okay, you have to get 20 out of 20 in OET reading part A. If you are getting 15 or 14, it will affect your score. So you have to take it as a serious test. Okay, you have to take this as serious. Don't be there. Yes, I can do this. I can don't take it as a silly. Okay, you have to take it as a serious. If you get 20 out of 20, definitely you will get good score in OET reading part OET reading subtest. Okay. So if you are getting less mark in B and C, you can compromise here. Okay. You can adjust here in OET reading part A. Okay. What is the maximum percentage? Maximum percentage of a young patient body to which cholesterol may be applied. What is the maximum percentage? Young patient. See, young patient is one keyword. Maximum percentage cholesterol may be applied. Cholesterol is another keyword. Okay, go to the medication. What medication is in the test B and test D. See, calcitol here is also calcitol here is also given, but young patient is not given here, and percentage is also not given anywhere in this passage. So you have to go to the test D. Calcitol we got. Okay, calcipetrol we got percentage, sorry, not calcipetrol, calcitrol, sorry, calcitrol. What is, I want to check once more, okay. What is calcitrol? Sorry, calcitrol we got, okay. And young people, see, young people we got here, another keyword, and percentage. What is the percentage? They are asking the maximum percent, only 1% given in this, what is percentage? 35 percentage, okay. Calcitrol, not more than 35% body surface to be treated daily. See, what is the question? What is the maximum percentage of young patient body to which calcitrol may be applied? What is the maximum percentage? 35 percentage. Okay, are you getting my point? This is the way you have to find out the answers in short answer. Okay, now we are going to do the sentence completion 15 to 20. Here, patient with the fever in addition to pustule. So, some signs they are saying signs fever, signs of symptoms. Pustule, plagues, and red skin may be suffering from. Okay, maybe suffer patient with the fever in addition to pustule, plagues, and red skin may be suffering from what? Okay, this information we will get in OET. Sorry, test number A. Okay, test A. What are the points we got? In addition to fever in addition to redness. Okay, you have to scan properly most. Okay, you have to scan properly. Okay, see, 1 minute. Good day, sorry. What is the question? What is the question? In addition to fever, we have to find fever in addition to pustule, plagues, and red skin. Okay, maybe suffering from water. Patient with the fever. Patient with the fever. We have to find out fever anywhere in this fever. Okay, patient with the fever. Surgeon. See, we got the pustule within place, psoriasis, red tender skin. Okay, we got the 1 point here. This may occur acutely and may be associated with the fever. Fever is also we got here. Okay, generalized pustular psoriasis is rare. See, what is it saying? Generalized pustular psoriasis is rare and is characterized by. See, they are saying describe and is characterized by the development of multiple sterile non-follicular pustule. See, we got the point. Pustule got, okay, pustule. Another point, plaques and red skin. Pustule, plaques, psoriasis, or red tender skin. We got three keyword here. This may occur acutely and may be associated with fever. See, again another keyword also we got here. Then what is the condition? What is the condition? Generalized pustular psoriasis. What is the condition? What is the answer here? Generalized pustular psoriasis. Okay. There is less, see, less, okay, less. Dash of the skin, if the patient has palmoplantar psoriasis. So, one keyword, there is less of the skin and palmoplantar psoriasis another keyword. Okay, we got two keyword here. Then it will, this information we get in text number A. If it is not in the test number A, you have to go to test number uh, sorry, see, what is the question? One more. Skin of the patient has a palmoplantar psoriasis. Okay, psoriasis maybe mostly this information we will get in the test number A. Otherwise, we have to go to another test. Okay, palmoplantar psoriasis. What is the chronic plaque psoriasis? One here, palmoplantar psoriasis. Mm. So it is not in the test B. Then if it is not in the test B, where we have to find plasma. Sorry, what is the test they are saying? Plasma. I have to check once more. Okay. Palmoplantar. Sorry, there is less dash of the skin if the patient has a palmoplantar psoriasis. Okay. Palmoplantar psoriasis. If it is not in the test, you have to go to next. Where we will get. Maybe in the test C. Go to test C. Palmoplantar psoriasis. Palmoplantar psoriasis. Palmoplantar psoriasis. Okay. See, it is not in the test B, it is in the test A. Sorry, it is in the test A. Palmoplantar disease. Okay, we got the point here. Palmoplantar disease, that is psoriasis. Okay, I have doubt in test A, but I didn't find out. So if you are stuck in this type of answer, mainly these answers you will get in test A or test B. So it is talking about psoriasis. Okay, again, see here also I face some problems here. Okay, some same situation you will face in your exam also. So then you have to, again you have to, sometimes we read fastly, we won't find out the exact keyword. See, in this scenario, again you have to come to the which test you are getting you have doubt, again you have to come there, and again first you have to scan. See, again I came here in what test A. Again I fastly read, then I got the point palmoplantar disease. Okay, I got the point palmoplantar disease. What is the question? What was the question? There is less dash of the skin if the patient has palmoplantar psoriasis. There is less dash of the skin. Okay. See, you have to read, you have to properly scan it here. Okay. Scaling is reduced at the flexural site on genital skin and in palmoplantar disease. What is less? What is less? Less is the another keyword. There is less dash of the skin. Okay. There is less. Scaling is reduced. Reduced means less. At flexural sites on genital skin uh, and in palmoplantar disease. Okay, palmoplantar disease and genital side scaling is reduced. That is less in, there is less scaling of the skin in if the patient has palmoplantar disease. How we are getting the answer? They are given the palmoplantar psoriasis, but we went to passage A, then uh, we searched for palmoplantar psoriasis. Okay, but we didn't got the word there, palmoplantar psoriasis. Okay, but they are given the word palmoplantar disease. Okay, palmoplantar disease, they are given the word palmoplantar disease, but the passage is talking about the psoriasis. Okay, the passage is talking about the psoriasis. We got the Where here keyword is palmoplantar psoriasis. Then we went to test B. There also we didn't got the word palmoplantar disease. Then we have again we got out in passage A, then we came here, we got the point. So this is the way you have to find out the answer. So if you stuck anywhere, if stuck any passage, if you stuck any questions, again go there and find out the answer. Definitely you will get. Okay, we are going to find out the keyword. Here the keyword is here. We will get the answer in that point only, not any other place. Okay, so we got the answer scalp. Okay, are you getting my point? The Casper criteria should be applied to patients who are already diagnosed with this. So, Casper criteria in the passage B should be applied to a patient. How should be applied to patient who are already diagnosed with what? What? Okay, that is the question. See, Casper criteria is in part C. We got the point here. Casper criteria. Then what is the next question? Should be applied to patient. Where should be applied? Okay. A patient must have inflammatory articular disease and 3 or less than greater than 3 and it is equal to 3 points from a following criteria. Patient must see Casper criteria where we will apply the patient have inflammatory articular disease. We have to apply this criteria. So you are getting my point. Inflammatory articular disease. What is the answer? What is the answer? Inflammatory articular disease. Okay. Poor formation. That is something is poorly forming, okay, of poor formation of the dash, okay, including pitting is another can indicate PSA. See another keyword PSA. So we have to go the point, we have to find out the keywords PSA, pitting, poor formation. So the information we will get in part C, okay, test C. Sorry, always I am taking part C because usually I am taking reading classes. So that's the reason I am taking part C, part B, part A. Okay, this is test C. Sorry for disturbing. You will get this information from test C. PSA is psoriatic arthritis. We got the point here. Okay. Then what is the question? PSA indicate PSA, pitting and poor formation. Pitting. Pitting, you have to find out any point they are saying that. See, we got the pitting. See, got poor formation. So, pitting here it is category where it is saying psoriatic nail dystrophy on current examination they are saying. Psoriatic nail dystrophy. Some point they are saying here. Okay. So, what is the question? I read once more. Poor formation of the dash, including pitting, can indicate PSA. Between what? Poor formation or something poor formation or something, maybe here something. Okay, means here it is a psoriatic is a disease condition. So where it is nail dystrophy, psoriatic nail dystrophy on current examination, ongolysis, pitting and hyperkeratosis, it is given the description. So what is the poor formation? Nail dystrophy means dystrophy. What is the meaning of dystrophy? Find out the meaning of dystrophy. Dystrophy means dystrophy of nail. That is a what is dystrophy means? Poor formation. Formation of what? Nail. What is the answer here? Formation of nail. Okay, are you getting my point? Okay, are you getting my point? Okay. Around half of the patient is one keyword with the PSA, another keyword will have pain somewhere in the joint. These are the keyword. Half of the patient, PSA, pain in somewhere in the joints. Okay. So PSA, go to PSA, see here is the PSA, half of the patient. See, you have to read here. See here also we got we have to scan it properly. A joint pain. He severe we got joint here. Okay, joint pain we got. So we have to read here. Therefore, early detection and treatment are paramount. On physical examination, affected joints may have asymmetric stress pain. That is joint line tenderness and effusion with approximately 50% of case 50% of cases affected. That is the 50% case affected distal pharyngeal joints. Okay. So what is the question? Half of the patient. Half of the patient means 50% of cases. That is half of the patient. They are measuring the half of the patient. Okay. With the PSA we got We'll have pain in the dash of the point. Pain. Here is saying about the pain, stress joint. Joint line tenderness, where it is the distal interpharyngeal joints. Where it is the distal interpharyngeal joints. Pain will affect in the distal interpharyngeal joints. Okay. If psoriasis on the fleshes fail to respond to mild corticosteroids, psoriasis fail to respond mild corticosteroids within dash should be stopped. Corticosteroids within the dash, the treatment should be stopped. Okay. If psoriasis of the fleshes fail to respond to a mild corticosteroids within, they are asking the period. Okay, within. So we have to go to mild, moderate. See here we got mild corticosteroids and fail to respond another keyword. Uh, um, See, we have to read this sentence. Once or twice daily, mild or moderate corticosteroids applied for maximum 2 weeks. Discontinue. Stop. Discontinue if unsatisfied. Then what is the answer? Failed to respond within 2 weeks. The treatment should be within 2 weeks. We have to write 2 weeks here. Okay. Are you getting my points? You have to watch every question. You have to watch every question. You have to find out what are the techniques I have applied here. Okay, what are the techniques I have applied here? Okay, you have to follow this technique. Definitely, you will get 20 out of 20 OET reading part. Okay, when I explain this method, maybe the time will extend to more than 15 or 20 minutes. Okay, when you do the test, definitely you can complete within 30 minutes. Definitely 100%. This is proven technique. Okay, to prove a texted and verified technique, please follow my technique when you are approaching OET rating subtest. Okay, then we have to come to the match the following. Okay, this is 1 to 7 question. Okay, how much psoriasis ointment is taking? Okay, where we got ointment is required for various areas of the patient body, various patient of the body. How much psoriasis ointment, how much quantity they are saying, asking. Okay, maybe this information we will get in test B or test D. Test B is also talking about the treatment. Test D is also talking about the treatment. So first you have to go to B, and how much, what is the question? How much psoriasis ointment, how much amount? But here it is not a how much they have to apply. It is not anywhere. It is not only weeks, and they are saying not any how much they are saying, not saying any how much we have to apply. So come to the D. See here it is saying how much we have to apply. Okay. What is the question again? Again give it areas of the patient body. Areas. These are the areas. So what is the answer here? D. Are you getting my answer? Are you getting my point? D. What the skin of the patient with psoriasis looks like. So signs some signals. What the skin of the patient with psoriasis look like? Where we will get in part A, test A. Sorry, test A. See where we will get the skin of the psoriasis look like. You have to read properly in test A. You will get this information. Okay. Then a way of determining whether a patient has a psoriatic arthritis. What is the way? What is the way determining whether a patient has psoriatic arthritis? Arthritis is this another keyword. See, psoriatic arthritis. See, psoriatic arthritis. The way. What is the way? CASPR. Okay. Then what is the answer? C. Here A. C. Okay. The consequence of not treating a disease which patient with psoriasis may go on to develop. The consequence of not treating. This is a keyword. Not treating. So not treating a disease which patient with psoriasis may go on to develop. Where we will get, maybe we will get A. If it is not there in the A, then you have to check C. Okay. You see, you have to fastly you have to see. Consequence note is not there, then B it is not there in the treatment. Okay. See, we are gaining some points. Okay. If left untreated, see we got the point, left untreated PSA could result in a progress joint damage leading to severe disabilities. Okay. What is the question they are asking? If untreated, consequence of not treating a disease left untreated which patient psoriasis may go on to develop what, may go on to develop what, okay, this severe disability. Okay, that is the point. So what is the answer? What is the answer? Test C. Okay, are you getting my point? Prescribing vitamin D for adults with the psoriasis. Vitamin D prescribing. Where we got this information? Vitamin D. Vitamin prescription. Vitamin D. Where which was it? B. Okay. Vitamin D B. Okay. Easily you can find out the answer. If you do that question from 7 to 20, definitely you will get the match the following answers. Okay. Various conditions that may be confused with the psoriasis. What are the various conditions? Talking psoriasis. First topic, test number A, various condition. Pulmonary disease, there are so many conditions they are discussed in test A. So then what is the answer in last question number 7? Test A. So this is the way you have to find out the answer. Please, my humble request to every viewers, please watch my videos till the end. Okay, till then, please watch my videos till the end, and you have to boost your OET reading part. OET reading part, yes, but definitely you have to boost. Okay, definitely watch my videos till the end, and you have to understand what are the tips and techniques I have applied here, and you have to apply here and get 20 of try to get 20 out of 20 in OET reading part. Here. Please, today signing off Tasanda. Please watch my videos till the end and subscribe my channel and press the notification icon. Okay, today signing off. Thank you for watching my videos.